Mulago National Referral Hospital has managed to discharge more than 20 COVID-19 patients who have recovered from the coronavirus. Most of the discharged persons presented with severe cases and needed extra attention. They had additional conditions co-occurring with the coronavirus.
So you find you go in to see a patient when about 7 doctors. Imagine 7 doctors examining one patient. Those who are specialists in the heart, those of the lungs, those of diabetes, those of hypertension, those of kidney, those infectious diseases, those of neurology, and so forth.
The nationwide lockdown has enabled the health teams to get rid of coronavirus in all patients who have been discharged. However, more cases have continued to be imported from neighboring Kenya and Tanzania, thereby creating fear that the situation might run out of hand.
We have a president who cannot allow us actually to reach that. You know, a president, how firm he is, he will just have rocked. Even when time comes and he opens, should cases increase, he will rock. He will rock. So we can't reach that situation.
But what makes this doctor confident when coronavirus continues to bring developed countries down on their knees?
Trust the Ugandan doctors, the Ugandan health workers. We are very well trained to do that. Who doubts Makerere University? Makerere University has been one of the best universities in Africa, especially training medical doctors. We are brainy. We may not have equipment, but the brains we have, these infections which come here, we shall hammer them.
The executive director, Mulago National Referral Hospital, Dr. Baterana Byarugaba, told UBC TV that many people are vanishing due to comorbidities, but not necessarily coronavirus.
Somebody may have COVID but die of cancer. But because COVID is here now, it is the talk. They will say he has died of COVID. I am not underscoring the fact that COVID kills.
At Mulago National Referral Hospital, coronavirus patients are isolated and treated in their own wards, and no other patients are admitted in these very wards. However, there is a possibility that those who recover from coronavirus can be reinfected once they get into contact with the virus again. This time, though, might not be as severe as the first infection. Dr. Byarugaba believes that coronavirus is manageable and that the allocation given to the national budget is just enough to support the fight against the disease.
Remember that we need agriculture to know that food is the first drug actually you need. So the money that goes into agriculture is going to health. We need education. Look, you need education to educate these younger people to know that they must wash their hands and go to the toilet properly. That is health already, isn't it? You need good roads to know that actually you are the mothers. It can be brought to Mulago very quickly. Isn't it so? So that is good to health. And also you need the protection. You need to have peace in the country. You need money for UPDF, for police to put security to protect you, to be healthy and sleep very well.
Mulago National Referral Hospital has a 900-bed capacity in Lower Mulago with 44 ICU beds, surpassing the World Health Organization international standards. However, not every case of coronavirus requires ICU attention. Most of those who are admitted require oxygen, and all referral hospitals in the country have oxygen plants and are able to save patients' lives, especially those in dire need. Michael Jordan Lukomwa and Ivan Kahwa for UBC TV, Mulago National Referral Hospital.